Hi, my name is Dr. Zachary Pope.
Hi, my name is Dr. Rohan Datta.
We work with Doctors Austin Parish and Jason West. We all currently work at Lincoln Medical Center in the South Bronx of New York. Our lightning oral abstract is titled Not Enough Shades of Gray, Shortcomings and Systematic Reviews of Emergency Medicine Literature. As a disclosure, we have no conflicts of interest. Steadily increasing emergency department utilization over the past few decades necessitates high-quality research to inform clinical decisions about our field. Systematic reviews and meta-analysis are the highest level of evidence as they synthesize all available evidence about a certain topic and use statistical analysis to make a conclusion that emergency medicine physicians can use to guide their practice. The validity of an SRMA depends on the search strategies that they deploy. This includes following certain reporting guidelines like PRISMA that provide a checklist for authors to ensure that an SRMA has all the necessary components. An SRMA should also search for gray literature, which is literature not published by commercial publishers. They should also search clinical trial registries and reference lists, as well as acknowledge publication bias. The quality of systematic reviews in emergency medicine was first called into question nearly 2 decades ago, but there have only been a few studies since. In 2001, a study found that the most SRMAs rarely address search strategies and publication bias. Another study done in 2014 showed that clinical trial registries are not routinely searched. The most recent study done in 2019 found that a selection of SRMAs did not adequately adhere to the PRISMA statement. Our aim was to determine the extent to which SRMAs in emergency medicine perform a complete search strategy. We defined a complete search strategy as one that searches for gray literature, searches reference lists, and searches clinical trial registries. We searched PubMed for SRMAs published from 2009 to 2019 in 10 emergency medicine journals chosen by our research team based off the top 20 journals as defined by Google Scholar for their H5 index metric. 3 reviewers confirmed that each study was an SRMA and extracted the following information: the type of question studied, the year of publication, whether the SRMA used reporting guidelines, mentioned gray literature and publication bias, and searched clinical trial registries and reference lists.
Our results indicated total we searched 550 SRMAs, 30% used a complete search strategy, 40% searched for gray literature, 80% manually searched reference lists, 40% searched a clinical trial registry, about 55% mentioned publication/reporting bias, and about 65% mentioned following reporting guidelines. We created this figure as it shows the proportion of SRMAs that used a complete search strategy versus the publication year of the SRMA. As you can see, there is significant variation from year to year, but overall there has been a drop in the quality of SRMAs in terms of search strategy from 2009 until 2019. While SRMAs published later were less likely to use a complete search strategy, they were more likely to mention reporting guidelines and address publication bias, which is consistent with the definition of publication bias. There was no significant relationship between using a complete search strategy and journal impact factor. Complete search strategy was also not significantly related to the use of reporting guidelines. Overall, we revealed that while a majority of SRMAs in emergency medicine mentioned some form of gray literature, less than a third of them used a complete search strategy. This means that a majority of the SRMAs that we use to make decisions in emergency medicine have significant publication bias because they tend to not include all the literature around a topic, especially unpublished studies. This is a problem because while most SRMAs are flawed, they continue to be produced at much higher volumes. SRMAs have been mass-produced from 1991 to 2014, as there has been an increase in the publication rate of almost 3,000%. We postulate this increase is due to SRMAs being the highest level of evidence, and thus very important research to publish, but also that they are relatively easy to produce because they are retrospective, require minimal funding, and do not consistently follow the same methodology. Producing high-quality SRMAs has not only been a challenge for the field of emergency medicine, but also for other medical specialties. While these studies used an older SRMA quality score checklist or a newer one such as PRISMA, many found an inability to adhere to all aspects of the checklist.
Our limitations include that we are studying a concept, the complete search strategy, that has never been studied before, and thus there is no previous literature to identically compare it to. Our study is also only limited to a decade's worth of SRMAs in only 10 journals. Due to this limitation, results of the study can't be generalized to all SRMAs. We envision the future of SRMAs to include there being a basic search strategy that incorporates everything we mentioned and that is widely accepted by physicians. We also believe that prior to publication, there needs to be a more stringent review process by editors that ensures this complete search process is followed. Due to SRMAs being such a high level of evidence, if these steps are followed universally, all physicians can feel more comfortable using SRMAs to help with clinical decisions. Thank you.